Infertility is a deeply personal challenge that affects millions of couples worldwide, often leaving them searching for answers as to why pregnancy remains elusive. Among the myriad causes of infertility, some are well known and frequently investigated, such as blocked fallopian tubes, ovulatory disorders, or diminished ovarian reserve. Yet, there exists a more subtle, often overlooked condition that can significantly impact a woman's ability to conceive: luteal phase defect. This hidden culprit is both elusive and complex, but understanding its mechanisms, implications, and possible treatments is crucial for anyone struggling to start or expand their family. The menstrual cycle is a finely tuned symphony of hormones and physiological changes, typically lasting around 28 days. It is divided into two main phases: the follicular phase, which begins with the first day of menstruation and ends with ovulation, and the luteal phase, which follows ovulation and lasts until the onset of the next period. The luteal phase's central role is to prepare the uterus for a potential pregnancy. After ovulation, the ruptured follicle transforms into a structure known as the corpus luteum. This tiny glandular body is vital because it secretes progesterone, a hormone essential for creating a supportive environment in the uterus. Progesterone thickens the endometrial lining, making it receptive for a fertilized egg to implant and develop. If fertilization does not occur, the corpus luteum disintegrates, progesterone levels drop, and menstruation follows. A luteal phase defect, often abbreviated as LPD, is a condition in which the luteal phase is inadequate, either too short or marked by insufficient progesterone production. This inadequacy means the endometrial lining fails to develop properly, making successful embryo implantation difficult or impossible. Women with LPD may find themselves able to conceive, yet unable to sustain a pregnancy beyond the earliest stages, leading to recurrent early pregnancy losses or unexplained infertility. The causes of luteal phase defect are varied and complex. Sometimes the issue lies in the ovary itself. Perhaps the follicle never fully matures, leading to a corpus luteum that cannot produce enough progesterone. In other cases, the problem may stem from an imbalance in the hormonal signals originating from the brain, particularly from the hypothalamus and pituitary gland, which regulate the entire menstrual cycle. Certain lifestyle factors and medical conditions are also associated with an increased risk of LPD. Excessive exercise, extreme stress, and low body weight can disrupt the hormonal balance required for a healthy luteal phase. Medical conditions such as polycystic ovary syndrome, PCOS, thyroid disorders, and elevated levels of the hormone prolactin can also play a role. Sometimes the reason remains unclear, making the condition even more frustrating for those affected. Diagnosing luteal phase defect is notoriously challenging. Traditionally, it has involved tracking basal body temperature, performing endometrial biopsies, or measuring progesterone levels during the luteal phase. None of these methods are perfect. There is ongoing debate in the medical community about the best approach, and even about whether LPD is always a clearly defined problem in itself, or a symptom of broader reproductive issues. A woman may suspect a luteal phase defect if her menstrual cycles are consistently shorter than 26 days, or if she experiences spotting between ovulation and menstruation. Still, these signs are not definitive, and many women with LPD have entirely regular cycles. This ambiguity highlights the need for careful evaluation by a fertility specialist who can piece together the puzzle from medical history, cycle tracking, blood tests, and sometimes ultrasound examinations of the ovaries and uterus. For couples trying to conceive, the implications of a luteal phase defect can be emotionally taxing. Month after month, the hope of a positive pregnancy test is dashed, often with little explanation. In some cases, a woman may achieve pregnancy only to experience early miscarriage, typically before she even realizes she was pregnant. This cycle of hope and disappointment can exact a heavy emotional toll, making support and understanding vital components of care. Treatment for luteal phase defect is tailored to the underlying cause whenever possible. If lifestyle factors are contributing, Interventions might include moderating exercise, managing stress, or achieving a healthy weight. When medical conditions such as thyroid disease or elevated prolactin are identified, targeted therapies can restore hormonal balance and improve fertility outcomes. One of the most common approaches to treating LPD is progesterone supplementation. This can be administered as oral medication, vaginal suppositories, or injections during the luteal phase, starting after ovulation and continuing until pregnancy is confirmed. Progesterone supplementation helps to ensure that the endometrial lining is sufficiently thick and stable to support embryo implantation and early development. Sometimes, medications that stimulate ovulation, such as clomiphene citrate or letrozole, are prescribed. These drugs aim to optimize the maturation of the ovarian follicle, potentially resulting in a healthier, more robust corpus luteum, and thus improved progesterone production. In certain cases, assisted reproductive technologies such as in vitro fertilization, IVF, may be recommended, especially if LPD is accompanied by other infertility factors. It is essential to note that research into luteal phase defect is ongoing, and some experts question whether it is always a standalone diagnosis or a marker of other underlying reproductive issues. Nevertheless, for many women, addressing luteal phase inadequacy has made the difference between repeated disappointment and a successful pregnancy. The journey through infertility can be fraught with uncertainty, self-doubt, and frustration. Yet, understanding conditions like luteal phase defect empowers women and couples to advocate for themselves, seek appropriate testing, and explore effective treatment options. Open communication with healthcare providers and a willingness to explore all possible causes of infertility are key steps on the path to parenthood. In the end, luteal phase defect serves as a reminder of just how delicate and intricate the process of conception truly is. A small disruption in the hormonal interplay can have significant consequences, but with knowledge, perseverance, and the right support, many couples can overcome this hidden barrier to achieving their dream of a family. As awareness grows and research advances, hope remains for those affected by this subtle yet impactful cause of infertility.